Okay, just moving on to our next speakers. We have three coming to you from Wax Custom Communications. We have Craig Fairfield, the managing director there, with 20 plus years of professional experience, who've taught him many things, including the value of putting himself in the shoes of others and thinking critically about their motivations and desires. He's worked on both the agency and client side as a strategist, researcher, writer, planner, and account manager for brands like Humana, Seagate, Louisville Slugger, Crosley, U of L Healthcare, United Way, Louisville Ballet, Habitat for Humanity, and many others. Joining him is Mike Fox, the Chief Clinical Officer at Motion PT Group, where he serves as Chief Clinical Officer. As I just said, he's a board certified sports clinical specialist, a member of Mount Sinai Trusted Rehab Work Advisory Board, and a hospital for special surgery credentialed advanced hip clinician. Michael helped form Motion PT Group in 2015, having co-founded STAR Physical and Occupational Therapy in 1999. And along with them is Wendy Ross, the marketing vice president of marketing there, where she's a key member of the company's COVID-19 task force. She's responsible for all aspects of Motion's marketing efforts, including branding, content strategy, digital media, patient-physician engagement, and go-to-market plans for new clinical programs such as Motion on the Go and post-COVID recovery. So I'll turn it over to Craig, Mike, and Wendy.
Hey, thanks a lot. Really appreciate the setup there. That was some good stuff about how to bring patients back. I enjoyed that previous segment. It aligns nicely with some of the things that we're getting ready to talk about too. I'm excited to be here with my friends Mike and Wendy from Motion. We've known each other for a couple of years, and I've been impressed with their organization for all of those years, to be perfectly frank. When I first met them about 2 years ago, they were running a very tight ship. Trying to get my slides going here, hang on. They were running a very tight ship. I got the chance to go to New York and visit with them and learn about the organization. And the first thing that impressed me was just how focused they were on their mission. And that's a critical part of the story that we're getting ready to tell, because everybody on their team, from the top down to the people answering the phones, know exactly what Motion stands for. They know why Motion exists. And that's critical to speaking clearly and powerfully about your brand. And by the way, that's what Motion invited Wax to do, was to help them clarify their brand, create some tools, and really have some powerful differentiation factors to use. So I was excited to have that opportunity. When I first met you guys, you had 50 plus clinics, which you still have, hundreds of employees, thousands of patients, and a business plan, an ambitious business plan for growth. We had no idea what was getting ready to happen, right? A little bit over a year ago, as Lisa just pointed out a minute ago, pretty much everything changed. Fortunately, we were in a pretty good position to pivot with that change and continue doing what Motion is built to do, which is help people who need help, right? Mike, I'd like to invite you to talk a little bit about what happened around this time last year when COVID did change everything.
Craig, it's certainly been a pleasure getting to know you and your team and working with you. And I also really appreciate the opportunity to share our experience that we've gone through over the past year. We practice up and down. We have locations up and down the Eastern Seaboard, but the majority of our clinics are in the New York City area. And as we know, New York City was the epicenter for the pandemic in America. We had more cases very rapidly. China and Europe were seeing. So we had to really think on our feet very quickly. So we went into crisis mode pretty quickly. On March 20th, New York, the New York governor closed down all non-essential businesses. Fortunately, therapists, it wasn't clear in the beginning, but we were very grateful to find out that therapy clinics were considered essential businesses. The first thing we did was make the decision to be open for critical care patients only. And that was important because it really allowed us to live up to our values in excellence in patient care. The vast majority of those patients that needed to come in were in our hand therapy division. Those were patients that were having surgery or had accidents really just as the pandemic was hitting. And if they didn't have therapy immediately, they would lose function in their upper extremity permanently. So that was probably about 1 to 2% of our patients, but we remained open where we needed to. Our therapists were The public transportation systems were a mess, but our therapists were coming in sometimes to treat 1 or 2 patients a day, just to make sure we got that care in. But the vast majority of our patients required that we convert to telehealth in a very short period of time. And we'll talk about how we actually did that. One of the other things that we instituted very early on, we have a history in our company of having town halls. Communication is very important to us. So we have town halls that we would do about once a quarter. We transferred that to 3 times a week so that we had communication pathways from leadership to our staff, and more important, back from our staff to leadership.
Right, for sure. Yeah, that's critically important, especially when something unexpected like a global pandemic happens, right? And you need to be able to talk all up and down the chain and out to your patients, the people who count on you, and your staff who you count on. You said you switched over to critical care only, and we all know that lots of things changed in the world. What did that mean for your patient volume? How precipitous of a drop was that?
Well, like I said, we had about 1 to 2% of our patient volume coming into our clinics. We dropped down to 40% of our expected volume for that time frame. Obviously, we still have the same amount of staff. So telehealth is the only reason that we were able to keep it at 40%. So making up that difference, 80% of our visit volume was telehealth, but we were still only at 40%. But I think we were fortunate to be at that 40%.
So you had an urgent need to not only take care of the patients who were counting on you, but also to figure out how to quickly refill the pipeline of patients and continue to do what you're built to do and to keep.
That's right. Our patients need us, and we had to figure out ways to keep them access to us.
Right, for sure. So I think this story is going to be really interesting and useful for our audience today because as Lisa acknowledged, and as this whole day is structured to do, there's an urgent need to bring patients back. And that's why the people who are on the line today are here. So this story is a great example of how being prepared for the unexpected and then executing in a very smart way can help to bring patients back. And I think, and I hope that everybody who's listening today will be able to take some of these ideas and figure out how to apply them to their own situation. Every situation, every organization is different, but good ideas generally work in every situation, every place. In this case, there's a formula, as it turns out, and I know Mike and Wendy, you guys had good plans and good structures in place, but you probably didn't sit down and make this formula initially, but reverse engineering it and thinking about how we got from this time last year to now, we can put these pieces together. So we're going to take a few minutes and talk about each of the 4 pieces of this formula of how you brought patients back. The first one is expanding access, which Mike's going to talk about more in a minute. Figuring out where are some new segments and how to reach those segments. Creating value for the world and therefore positioning yourselves as thought leaders. And then unleashing your advocates by getting the word out and using, allowing your patients to tell their stories and really leveraging the power of that. So Mike, let's start by talking about telehealth. You alluded to it a minute ago. PT is usually a very hands-on thing, literally hands-on. And by the way, Motion also does occupational therapy and speech therapy and a lot of subspecialty versions of both those, all those things too. But all of them generally require literally putting your hands on patients. Telehealth must have been a little bit of a struggle for your patients and your providers to understand. How did that go?
It was definitely a learning experience, and we were able to capitalize on one of our cultures within our clinical model is that education is probably the most important thing that we do for our patients, teaching them how to take care of themselves and improve their own lives. That really translated very well into telehealth. We couldn't put our hands on our patients, but we did have access into their homes. So what we had to do is we had to get that idea across to our therapists, that perception that we are a hands-on industry and profession, both from our patients to us and us to our patients, just so how we associate ourselves and really show the value that we can offer through education, but also, equally importantly, having access to their home environment. So function is what we're all about, and being able to work with people in their environment where they have their stairs, their feed couch, they have to pick up their child out of the crib, getting them to be able to take that camera with them and move them over to their environment where they need to function, and then educate them right there, then and there. That was a real turning point for us. So what we really had to do, though, if you put us back in that moment in the pandemic, is we had to go in overdrive. So it was all hands on deck training. Fortunately for us, we did have a vendor engaged about a year before the pandemic hit for telehealth, because our chairman's very forward thinking, loves to engage in technology that will set us up for success in the future. Telehealth is one of those. So over a weekend on a Friday night, we got our vendor set up to do about 4 or 5 different technical training sessions for our staff to make sure that there were no glitches on Monday morning when initiated this across the rest of our company. And our clinical team went into overdrive by creating about 8 different scenarios via Zoom video, that we could actually go through and role play what those sessions would look like. We have a pediatric video, we had a hand therapy video, we had different orthopedic videos. Those videos were really important because it allowed our therapists to see, wow, I can see where I can actually do this, so that on Monday morning when they actually engage their patients, they felt confident going into it. And overall feedback we got was, I'm really surprised with how effective that session was. And that's really what set us up for success over the following year. And we're still doing telehealth, nowhere near what we were doing early on in the pandemic.
Right. So bringing a big part of bringing patients back is meeting them wherever they are. And in the middle of the pandemic, that had to be online, and that allowed your current patients to access you, but it required you to educate those patients about how that would work, let them know that it was available, and also teach your therapists how to use it. That middle part about letting people know that it's available and helping them understand how it's even possible to do a therapy visit online. I want to invite Wendy to talk a little bit more about that. What you have some specific tools that you used, right, for the internal communications, and also just to make yourselves available to your patients and clients. Can you talk about that a minute?
Yeah, thanks, Craig and Mike. So in addition to expanding access to care, we also really found the importance of expanding access to communication. And so, normally patients are calling our clinics, referral sources are faxing to us. We were quick to engage patients on multiple levels through the pandemic, and this is really sustained all the way now into 2021. Engaging on social, not just posting on social, but engaging on social, adding a chat bot to our website, adding a hotline, a central number where anyone can call with a quick question. And now 10% of our calls coming into our organization are coming through that hotline. And also texting. So in addition to emailing patients and giving them the opportunity to email back, which is critical, we also implemented texting. So patients really could easily access motion and communicate with us two-way during a time when communication was critical.
Yeah, and they could do it however they chose to. And we all know from experience, and everybody on this call knows, different people, different ages, different situations are more likely to engage in certain ways. So if there's a takeaway from this piece of the formula, I think that's probably it. Make your services and yourselves available to people in as many ways as possible, and then deliver on those promises. Make sure somebody answers the phone and that person can get the right information to whomever's calling, all those things. So that's how you manage to keep 40% of your patient volume going on, right? By pivoting toward telehealth mainly, telling a good story and making it available to people wherever they were, stuck at home, moved out of town. You could have stopped there and just waited and hoped that this thing eventually blew over and that you'd get to the other side of it, and tried to ride that 40%. But of course, that's not how motion is built. So you didn't do that. You were following your own rules, and you were looking for ways to help people. And unfortunately, but fortunate that you were around to help them, a whole new patient segment emerged about that same time, right? everybody on the call is familiar with the term COVID long haulers, I'm sure. These are people who suffer long-term effects after recovering from an infection, and it's still not really well understood, but there is protocol in place to help these people get back to whatever the best version of their life can be. Mike, you already had a relationship going with Mount Sinai, and as a result of that, became part of this COVID long hauler program that brought you a whole new opportunity to help people and a new patient flow. Can you tell everybody a little bit about how that came to be and what that meant for you?
Sure. When I was listening to Lisa's talk before, that butterfly wall brought this slide to mind, because this is where we're really able to shine and help our patient population in a very meaningful way. So being at the epicenter in New York, Mount Sinai led the charge in really providing care for these patients that were not finding care anywhere else. They were going to their physicians early on, and they were being told that just sit it out, wait it out, you'll get better, or it was in your head. And it was the exact wrong thing to tell these patients. They needed hope, or they were going for therapy and they were getting pushed too hard and they wouldn't go back for any more sessions because it would take them 2 weeks to recover. These were a unique group of patients with very unique symptoms, and Mount Sinai really took the trouble to figure out what was going on with these patients, and then create protocols that rehab therapists like ourselves be actively involved with helping these patients. So fortunately for us, I was on I was a founding member in the Mount Sinai Trusted Rehab Network Advisory Board. So that set us up to be trusted to be able to care for their patients at clinics in the environments that Mount Sinai was seeing their patients. In fact, Mount Sinai was getting calls from patients in Maryland, DC, Maryland area, Connecticut, that we were able to serve in those areas as well. So we felt very well positioned to step up into this role. We learned very quickly. And what we'll talk about in a little bit is really how we tapped into our talent within our organization to very quickly create expertise in order to capitalize on these protocols and these patients that we're getting originally from Mount Sinai.
So by being alert to these opportunities to serve more people, and to interact with a good partner like Mount Sinai, you were able to bring in a whole new group of patients. Wendy, I understand that there have also been some other related kinds of partnerships with some long hauler support groups and some other things. Tell us a little bit about that.
Yes, through the patients that we treated collaboratively with Mount Sinai, we learned about Survivor Corps, which is the largest grassroots advocacy group for COVID survivors in America. They have over 100,000 members right now in their organization. And so we were able to connect with them and now be on their directory and connect with their member base, which really expands our reach and our ability to help more patients with our program.
Yeah, that's fantastic. So a key part of bringing patients back post-COVID, especially COVID patients, is being present and ready to help people, whatever kind of help that they need. A lot of the people who are on this call today have opportunities to do that with various populations, especially people who have delayed care because they didn't know if it was available, or because they were just worried that going to the doctor was more dangerous than not going to the doctor. So a good takeaway here, I think, would be to be alert to those opportunities and be connected with the right sorts of organizations around the services that you provide. So you could have stopped there. Again, you could have been a good partner for Mount Sinai. You could have delivered on the promise to the COVID long hauler patients and helped them to rehabilitate. And that would have been great, right? That would have satisfied your mission. But you didn't do that because you knew that there were more people who could be helped. And very quickly, an incredible new opportunity came by for you to become part of this COVID long hauler conversation, and therefore position yourselves as real subject matter experts, which is good for the long haul patients and also just good for your brand and your patient volumes in general. I got a phone call from Wendy one morning, and she said, good news, we're going to be on 60 Minutes coming up soon. That COVID long haul program that we're doing with Mount Sinai is on the national radar. And so great news, we're going to be featured on 60 Minutes. And I said, that's fantastic. I can't wait to watch it. And she said, and also, you know, that website that you've been working on with PPR, our web partner, that's going to need to launch by Monday instead of next month. And we're probably going to ask you guys to help us with a few other things too. And I said, oh, all right, awesome. Let's get after this. So 60 Minutes wanted to do a segment on these long haulers. We knew that you guys were going to be featured in there to some degree. Instead of just saying, hey, let's all watch TV and maybe we'll see somebody that we know, you really swung into action. Wendy, tell us what you did and how you did it, more importantly. Like, how do you make something like this happen quickly?
Yeah, appreciate that, Craig. So we are fortunate to use really dynamic communication systems within our organizations and even with our external stakeholders like WAX and our digital agency. We use Microsoft Teams, we use Yammer, we have SharePoint and different ways to communicate quickly. So we're accustomed to working very efficiently and communicating quickly anyway, but this was sort of supercharged. So the 60 Minutes opportunity came and really helped us move quickly and create resources that we thought, and I think anybody could say this in 2020, you know, it's amazing how much you can get done in a short amount of time when you realize you have to. So we got our new website up and we were positioned to engage in the 60 Minutes chatter, which was incredible, really, on Twitter and other social platforms the weekend that this segment aired, which featured COVID long haulers from Mount Sinai in motion.
So by being ready to take action and then being alert to action that needed to be taken, you were able to be in the right place at the right time. And that allowed you to do this third part of the formula, which is create value, right? You are experts at what you do. You have subject matter experts on your staff in all kinds of different realms, different descriptions. You quickly leveraged the power of that expertise to position yourselves as thought leaders. And you took advantage of the 60 Minutes opportunity to really get in on this conversation in a big time way. When the traffic hit the website, which it did, and when traffic hit the social media channels, which it did, you had a good story to tell, right? Mike, you mentioned to me earlier about the special interest groups, and you alluded to that a second ago. You take just a minute and tell everybody what that is and why that was important?
Yeah, sure. So during the pandemic, since our clinicians had some downtime, we engaged our clinicians into creating special interest groups in basically each area that we practice. We wanted to create content for expertise in that area. And to keep it simple, what we were able to do with that from our neurology special interest group, because these were really the types of symptoms that patients with COVID were having. They fall into that neurologic category, fatigue and shortness of breath, et cetera, that really fit into patients that have neurologic disorders. None of us were experts in post-COVID care. There was no such thing before.
There were no experts,
crazy to
right?
claim yourself. There were no experts.
Wasn't even.
Did have experts in treating their symptoms. So we were able to identify and tap into that expertise. And Puneet Dhaliwal, who ran our neurology special interest group, was really critical in helping us create the content that was meaningful to help us engage with the protocols that Mount Sinai provided, and then take it to another level internally within Motion. So that's just one example how we could tap into our expertise.
And also gave us good stories to tell and good information to put out there. Wendy, you spearheaded the creation of some special blog content, and we worked together to create a lot of really robust content with some of your people. Talk about that for a second.
Yes, Puneet Dhaliwal and Justin Simone and several other of our clinicians that were heavily involved in leading the training internally with our Mount Sinai clinical protocol, we're able to translate that into patient-friendly language. So really taking this heavy clinical language and saying, okay, what can a patient expect if they come to Motion for post-COVID care? So that's up on our expert blog now on Motion Minute, and really has gone a long way to breaking down barriers that patients might have when they're trying to make a choice of how to address these lingering symptoms of COVID.
Right. And that allowed you to be the experts in the room when people were looking for answers to this. And that's good for the COVID long haulers. And it's also good for anyone who's looking for expert care, an expert provider like yourself. So it gave you a platform from which to speak, and it gave you good things to say. So the takeaway from that part of this strategy is probably to look for those thought leaders, right? And then everyone should think about ways to really leverage those people in order to build up the entire brand or the entire organization as an expert, as thought leaders. There's a fourth part to this strategy too, though, that this formula that I think is really, really important, and it's really hard to do as well, and that's to tell the patient stories. You guys did a great job of doing what we called unleashing your advocates in this deck, right? Patients are your best advocates, but it's really tough to get them to tell the good stories sometimes. We're going to watch a video in a second, a quick one that's part of a series that you created with actual patient stories. But first, Wendy, if you can take just a minute and give a few tips about how to get patients to tell good stories and give reviews. How did you do that?
Absolutely, Craig. It's always a challenge to find patients and share testimonials, which we know are gold in marketing, because really happy patients are walking endorsements. But in this case with COVID, we really learned that when we were intentional in handing patients a megaphone, giving them a platform and a voice to share their story or their testimony or a review about Motion, or to share with a friend and refer a friend to Motion, that we saw an overwhelming response. So just by simply being intentional and giving patients maybe a one-sentence survey that says, what did you like about your telehealth experience?
Right.
We received hundreds of testimonials, major spike in Google reviews, and also a huge jump in new screenings of patients referring friends. And we got awesome testimonials like this one from Ernesto, who's a New York City transit worker that came to us from Montefiore to our Bronx Bainbridge clinic to work with Janice, our clinic director there.
Let's take a look and see what Ernesto had to say.
COVID, it just changed me, especially the weakness in my legs. Couldn't even walk. Physical therapy has been a godsend. My legs have gotten stronger. The staff are very helpful. They're trying to make sure that I don't overdo it and that I'm safe. They don't know how much this has meant to me. I was just made a grandfather. My goal is to get stronger and play around with that kid, wanting to defy the odds.
He wants to get stronger and play around with that kid. That's good stuff. If you guys on the call would like to see more videos like this, you can go to motionptg.com and you can watch some more too. They're really powerful and they tell good stories. And they get results too, as Wendy said. People pay attention to these. They open the messages. They give reviews when they're invited to do so. Often they're just looking for an easy way to interact in that way. And if you make the path smooth, you can get those good stories going. The other side of that coin is if you don't make the path smooth, you're probably only going to hear from people who are unhappy. And that's unfortunate because that doesn't really tell the story. So to wrap up here, let's take a look at where you guys are today. I understand that you've treated already hundreds of COVID long haulers, and unfortunately there are many hundreds more who will need what you are doing together with Mount Sinai. So great that you're available for them now and that you've got the protocol all worked out. I also understand that you're back to about 99% of your visit budget, which is also fantastic. I'm sure some of that would have come back organically, but I also suspect that this formula that we've been talking about for the last half hour had a lot to do with giving you a running start back to that 99%. Is that true, Mike?
Spot on, Craig. Spot on. A lot of work goes into getting us back to 99%. It didn't happen passively. Absolutely.
So a few takeaways for people who want to get their patient volume back to 99% or to 99% if it was never there in the first place, which is not uncommon. Remember this formula. Make it easy for people to access what you do. Always be looking for new segments that you can reach out to and engaging new partners. Create value and position yourselves as the thought leaders that you are, and leverage the power of your advocates to get the word out. That's really a critical thing. That last one especially, and difficult. And then the last thought is look for ways to keep your organization in the conversations. Find what people are talking about. Find out the questions that are being asked, and think about how you can help to answer those questions, how you can help people live their healthiest lives, and then get out there, get in the conversation. And that's what we have. If you want to know more about what Motion does, I dropped their URL a second ago. It's motionptg.org, and you can see a lot more of this kind of stuff there. If you want to know more about what we do at WAX, you can visit us online at waxcom.com and see some case studies and some other work that we've done for Motion and other clients too. I think we have a couple minutes left for some questions. Do we have
Sure,
questions?
Craig.
Yeah.
Someone says you suggest joining conversations. How do they figure out what conversations to join?
That's a really good question. I know we use some tools here at WAX to help us see what those conversations are. Sometimes it's as simple as setting Google alerts for different kinds of topics that we know we want to get in on. And definitely to keep an eye on the news of the day, both online and on social media. I made a note a few minutes ago. I can get to it here. Lisa said in the previous presentation, she said, stalk social media, which I thought was really good. And I wrote that down because I want to bring that back around. It's a great place to see what the conversations are. Those are my suggestions. Wendy, you have other ideas on how people can find the conversations?
Yeah, I was going to suggest, if you have a social media platform, they usually have social listening as an option for part of that. Sometimes it may be extra to pay for, but it's worth it. We also do media monitoring with Cision, and that just allows us to kind of see trends in what people are talking about. And then we have, for our size organization, one person who's dedicated to social engagement, who's literally just got her ear to the ground, looking at keywords like COVID long haulers, long COVID, that kind of thing, other categories for our industry. But it really helps because then she just dives into the conversation on behalf of Motion and just starts engaging. And it's really, I've learned the hard way that you have to be informal and agile and flexible to join a social conversation. It's not a corporate, it's not a corporate tone that you take there.
Right, for sure.
All right. And we have one last question for you. Oh, where did you go? I just lost it. 1 second. How my hospital doesn't do a good job with internal communication. Do you have any tips I can use to start making it better?
Better internal communication. Yeah, that's a great question because it's a big need in a lot of places. We do a lot of work around generating referrals, internal referrals for our hospital and health system clients, and that's a tricky challenge that needs to be met. And we have some tools for doing that. In that case, it usually comes down to creating the opportunities for those one-to-one relationships, and we do that through digital and traditional communication tools. I think just having a culture of communication is probably fundamental to how Motion does it. Is that right? Mike, Wendy, you guys want to talk to that?
Yeah, no doubt. And Wendy, I'm sure, can give a much more robust answer than I can on this topic. However, one of the things that Wendy does really well in finding conversations and open lines of communication, she's involved in so many of our clinical meetings, whether it's leadership meetings or what's going on, what direction, what initiatives we want to take, so that those communication lines are always open. It's not, you don't have to create them. Got her ear to the ground on what's going on, and she can insert herself wherever is needed, wherever marketing can best serve.
Wendy, how did you make that happen? Or how do you nurture that if it was already in place?
Yeah, well, we appreciate the question. As a marketer, I know it can be hard sometimes to get a seat at the table of the clinical conversations or even the other leaders in the organization that may not think that marketing necessarily has a role at the table. But, you know, just even one clinician within my organization was also interested in improving internal communication as I was. And together we formed a little internal communication task force and literally took people from different clinics, grassroots voices together on a task force to actively talk about how we could improve communication. And as a result, we started town halls, we started our intranet, which is everybody has access to everything real time. We started Microsoft Teams and Yammer, but it took a concerted effort cross-functionally to make that happen. And it's been a couple of years, but really successful and made us successful in this critical time.
Right. Yeah, it's a really great point. I'll bet one of the keys also was and is helping people understand how this is good for them, right? How it makes their job better, how it helps them deliver better care, whatever it is they're responsible for.
Everybody wants to be heard, you know, so giving them different ways to communicate besides speaking out loud on a town hall of 100 people. Oh, I can just send a Teams message or a Yammer and feel a little more, that's my safe zone. So giving people options for how to communicate two-way as well.
Right. That's probably a pretty good place to stop because that's good advice in general when we're speaking to the public and speaking internally.
Thank you guys so much. Craig, Michael, Wendy, really appreciate you guys taking the time today. And it sounds like you guys are doing some great work.
Thanks for
Thank you,
having us.
Scott.
We really appreciate the opportunity.
Thank you.
Thanks everybody for joining and listening in too. Hope you got something useful that you can take away and put to work tomorrow.
Yep, stay healthy and hope we'll get to see you guys live when we do it.
Likewise.